Good morning, everyone. Welcome. I am so excited to be talking to a nurse this morning. I have a very soft spot in my heart for nurses. So I don't want to do most of the talking. I want to get right to Deanna. Deanna, if you would open up by telling us about your career path. And if you think back, we have a lot of students coming to us from high school. Think back to your high school, what interested you in becoming a nurse, or maybe it wasn't at that point, but tell us a little bit about your career journey to where you are now.
Sure, good morning. Actually, in high school, when I was a senior, I took a business co-op class and needed to find a job as part of my classroom activity. I ended up being hired by the Sheboygan Clinic, which is now the Aurora Clinic, as a file clerk in medical records. I always knew I liked working with people and helping people, but at that time, I don't really think I knew what I wanted to do with my life. And working in that clinical setting and seeing patients, and even though I wasn't getting to interact with patients one-on-one very frequently, I started to understand that I wanted to go in some kind of healthcare. I started at the UW Sheboygan and went there for 2 years. And while I was there, I continued to work at the clinic. Then I took a break from school and I ended up getting married and raising a family. But while my children were young, I worked for a hearing aid company and became a certified licensed hearing instrument specialist through the state of Wisconsin. This particularly interested me because I'm hard of hearing. So I really enjoyed working with people who had similar disabilities, and it was very rewarding. So after my kids got to be a little bit older, I decided to go back to school, and nursing was the career that I chose. Initially, I went to Lakeshore Technical College, which is an excellent RN program, very difficult program, a lot of work balancing 3 children, and my husband was in the military. So it gave me a greater appreciation for multitasking. But what was really interesting was to work alongside my children while some of them were in middle school at the time and learning about APA format and writing career papers together. It was helped both of us understand and appreciate the hard work that goes into getting a good education. So as soon as I graduated from nursing school, I was hired at St. Nicholas Hospital. I started as a CNA and then worked, as I was working through my nursing school, gradually advanced in my jobs at the hospital. I became a nurse extern during my last year of school, which gave me a lot of opportunities to practice the skills that I was learning in school in a patient care setting. And then it was really a good move for me to work at the hospital while I was in school, because when I did graduate, I was offered several different jobs in the hospital. Then I went from med-surg and ended up working for an ambulatory surgery center. And this is where I really found my love for what I do now with outpatient surgery. Every area of nursing is different. Every department is different. That's what makes it so exciting. But I found my niche with outpatient surgery, especially ambulatory surgery. I enjoy seeing the whole patient experience from beginning to end and being there when they are discharged home, and so happy to get back together with their family. So after I did leave for a brief time for that ambulatory surgery center, I came back to St. Nicholas Hospital. They were affiliated with the ambulatory surgery center that I work at now. And eventually we became part of that family. Altogether, the hospital system bought us. I am currently working as a nursing manager of the surgery center, but also the one-day services department at the hospital and the Center for Digestive Health department at the hospital. So my role has greatly expanded over the last 2 years, but I continue to grow and enjoy every opportunity.
Wow, what great experience. I know, Deanna, that you had shared some pictures with us of some of your workspaces. Nikki, if you would just bring those up, and Deanna, if you would talk the students through those.
Sure. So particularly focusing on the ambulatory surgery center setting, just wanted you to get a better understanding for what a patient goes through every time they come to have a procedure performed at our facility. At the surgery center, we can do any kind of outpatient surgery, meaning that they will go home the same day. So when a patient comes through the door, this is where they go initially to register for their procedure. And we've made a lot of modifications lately with the COVID outbreak. As you can see, you might be able to tell there's a plexiglass window there to help protect our workers, but also protect the patients from potentially spreading a virus. So once they are done registering here, they're admitted in a room like this. And really we have curtains on most of our rooms, but we're still able to maintain privacy for all the patients. It doesn't get very loud. We try to be quietly efficient. That's our motto here at the surgery center. We could have up to 30 patients in a day, and they're all, the procedures are done by 3 o'clock in the afternoon. So that kind of gives you an idea of how busy and how many people are in the building. That computer that you see there is what we call a WOW, and that's how we do all of our charting in their medical record. This is a picture of the hallway. There are 2 procedure rooms in this hallway that we do procedures in. One is used for things like colonoscopies, and the other one is used for our pain management patients. I couldn't take you into the back by the operating room, but we also have 3 operating rooms in a different corridor. And then that's just an entrance to the sterile corridor area where we have the 3 operating rooms. And this is a picture of one of our post-op rooms. This is called phase 2. So when a patient is awake from anesthesia and ready to get up and sit in a chair and have their family member come and be with them, we get them in a room like this until they're ready to go home.
Great, thank you. Well, we're getting a ton of questions in, but I do want to go back to something that you mentioned, ambulatory.
So it's, yeah, ambulatory surgery center. Meaning we're a separate building, separate facility from the hospital. We're across the parking lot. So I go back and forth several times a day, but in this setting, we can do any kind of outpatient procedure as long as the patients meet certain criteria that's laid out by our anesthesiologists. They can come here. And one of the things about a surgery center environment is it's a little more fast-paced. Our admission process is done a little more quickly than in a hospital setting. They get really personalized care because we have the ability to have several people working at once. And, I think the most patients I might have at the same time would be 3, but they are in and out of the facility so quickly. We're continuously taking on the next discharge and just rotating through. It's like an assembly line. It really is like an assembly line, but our goal is to make it not feel like it's a factory setting. It's to be personal care for the patients.
Right. Okay, going back to, I want to start kind of at the beginning, that high school period. Are there any classes you would recommend for students now to either develop some of these skills or to even just, if they're in that beginning stage of figuring out, do I want to go into nursing? Do you know what some of those classes might be?
Well, definitely the CNA programs that they have available now are extremely helpful. I always recommend that to any nursing student or any person who's interested in healthcare. It's usually about a 12-week course, I believe. It's not very costly. A lot of times I think they're still doing them through some high school programs. There are other nursing homes and even hospitals now that will offer that course. And you can then potentially get hired right after you're done with the course. It gives you a feel for, do I really want to do something like this? Because even though I am now a nurse, that doesn't mean that I don't do some of the same duties that a CNA does every day. It's just a good way to get your feet wet and figure out if healthcare is what you want to do.
Right, exactly. And that's something they can do already in high school. So that's exciting for them. So after CNA, which is kind of, I don't want to say entry level, but it's maybe that first step in the process. What would be the next step in the nursing lineup? Because I know there's multiple ways to become a nurse or multiple different types of nurses.
Right.
Could you go into that?
Sure. So if you go to a technical college where I went initially, After you do the CNA program, then after 1 year, once you have your general education out of the way, you do your 1 year and you can become a licensed practical nurse. So you graduate from the program, but you still have to take a board certification to become licensed. There are a lot of licensed practical nurses that work in environments like clinic settings, nursing home care, passing medications, doing some assessments, treating wounds, things like that. In our hospital setting, we don't have LPNs. They usually do work more outside of a hospital environment, but there are some hospital systems that still do employ LPNs. After that, then another year in a program at a technical college, you can get your graduate nursing, and then you take your NCLEX, it's called. It's the exam that everybody has to take to become a registered nurse. So that is another year, and there you can work in pretty much anywhere you want to. Now, when I started in the hospital, I wasn't required to have a bachelor's degree as a registered nurse. That has changed over the last few years. They are moving toward requiring that of every nurse that works in a hospital setting. And it's just a good thing to get that much more education behind you. That's why, although I wasn't required to do it, I decided I wanted to. And I just did that within the last few years. I was fortunate enough to work here, and they offered scholarships and some tuition reimbursement. And my goal was to get through my BSN program without paying a penny of my own money, and I actually did that. So I earned my degree and my work paid for it. As a bachelor's degree nurse, I now have more opportunities opened up to me, not only in the hospital environment, but then in leadership as well. The next step would be your master's degree, and there are some leadership jobs will require a master's degree. If you ever want to go into teaching for nursing, that requires a master's degree. You can become a nurse practitioner, where you work alongside a physician in an office or in a clinical setting, and get to really see the patients, write prescriptions, do some diagnosis. You know, it just keeps going up from there.
Yeah, there's lots of ways. I think the most exciting part to me right now, if I were a young person, would be the fact that there's tuition reimbursement opportunities. You can start at 16, become that CNA, go into a 2-year nurse, and then be working and have them pay for your 4-year. So that's exciting. Lots of questions coming in. Is there a lot of opportunity to go from a registered nurse to a nurse practitioner or physician's assistant?
Definitely. I see jobs posted all the time for those positions. And honestly, that's the one regret I have. I shouldn't really regret anything, because I'm happy I was able to stay home with my kids, and all of the other opportunities I've had have led me to where I am today. But if I were younger, I would probably have loved to become a nurse practitioner. And back when I was going to school, those opportunities weren't out there as much as they are now.
Sure. Abby would like to know, what are the hours like? And obviously it would be different for the different departments, but maybe you could just go over a couple of them.
That's exactly it, depending on which department you work in. So that's one of the perks of my job as an ambulatory surgery setting. We're not open on weekends. We're not open on holidays. Most of our patients are gone by 6 p.m. If they're not, there's some reason for it, and they probably need to get admitted to the hospital. So we start our day about 6 o'clock in the morning, and we rotate our shifts a little bit, just so not everybody's starting at the same time. And then a couple of the nurses stay until the last patient is discharged home, which can be anywhere from 4:30 to 6 o'clock, or sometimes later. In other departments of the hospital, they will have different shifts around the clock. So 24 hours, a hospital is always open. A department like an emergency department, they would have 3 different shifts: a day shift, a PM shift, and a night shift. Some nurses will work 12-hour shifts. So they might work 7 o'clock in the morning until 7 o'clock at night. And then others work from 7 p.m. until 7 a.m. Med-surg, all of those inpatient units are the same, 24 hours a day. the other two departments that I manage at the hospital, the one-day services and the Center for Digestive Health, their hours really are weekdays from 6 in the morning. Sometimes they're there a little bit earlier than that until 6:30 at night, but they also take some calls. So that means there are some nurses that are at home, and if they get a phone call that a patient needs to come in and have a procedure done, then they will come in off hours and take care of those patients until they can go home.
Would you say that it's fair to say that a lot of the newer graduates have to kind of do their duties and do the PMs and nights? Do you see a lot of them starting there?
Yes, often that's what happens. And another thing that's a really good idea to do is to start on a medical surgical floor. You'll hear that a lot if you go into a nursing program to get some experience on med surg. Those patients are the ones that either had surgery or they might be admitted because they're just sick. They have the flu. They are getting dehydrated because they can't keep anything down in their stomach and they're just too weak to take care of themselves. So you'll get a variety of different kinds of patients, and it gives you a really well-rounded experience on how to multitask, how to prioritize. I have 6 patients. Which one should I go see first at the beginning of my shift, and why? And if you get a couple years of medical surgical on your belt, then you're able to have different opportunities to grow in different areas. But some nurses end up loving it so much that they stay on medical surgical for their entire career. But I did choose to stay on med surg, and I did work a PM shift the first couple of years until I was able to work and move into a day shift position. So yeah, that does happen.
Yeah, I would bet seeing that many different types of patients, you would get lots of different patient personalities. Margot would like to know, how do you deal with the patients who refuse to give you information or maybe refuse to cooperate with what you're asking them to do?
Well, that's where the psychology classes come in handy. You know, I look at those patients who are challenging, and I try to put myself in their place. What's going on here? They feel sick. They don't want to be there. And I try to empathize and say, if this were me or if this were my loved one, how would I want to be treated? And this is where the active listening comes into play, like you were talking about earlier. Sometimes I just sit down and I say, what can I do to help you? I know you don't want to be here, but in order for me to take care of you to the best of my ability, I need to ask these questions. And sometimes they get just sick of answering the same questions over and over again, but that's really a safety check for me. I might not have been the nurse that asked you those questions before. And although I'm looking in your medical record and I can see that you answered these questions before, I still need to make sure that these are correct so that I can better take care of you. Usually, I would say 99% of the time, they turn around and they end up being more compliant.
Sure. Showing them you care, I think, is a huge barrier breakdown. Would you say that is then the favorite part of your job? Is that personal relationship building, or what would you say is your favorite part?
Definitely, and that's why I love ambulatory surgeries so much. One thing on med surg for me that was hard is you'd spend days trying to figure out what's wrong with this patient. You'd be looking at their lab work, you'd be sending them away for procedures, and sometimes they just couldn't figure it out. And then you'd have a couple days off and you'd come back and that patient was gone. You don't know if they were discharged to a nursing home, and technically, because of privacy issues, you're not even supposed to ask. And for me, that was hard because I wanted the closure. I wanted to know, I hope they're okay, So at an ambulatory surgery center, almost every person comes in here and they're nervous. No matter what kind of procedure they're having done, They don't want to be there. They're scared. They don't know what's going to happen. And we get to be the ones that reassure them and tell them we're going to take the best care of you. And you build that relationship and that trust with them right from the beginning. And then you get to be there when they wake up from their procedure, and you get to give them the explanation of how they can take care of themselves when they go home. And best part of my day is when I get to call them the next day and ask how they're doing and if we took good care of them. And I do tell my nurses here now, I don't get as many opportunities as a manager to do that part of the job, but if I'm having a particularly bad day, I will do some post-op phone calls. And I always am uplifted by hearing how satisfied the patients are because they're so grateful we took good care of them.
Oh, that's awesome. Gosh, so many questions coming in, and I love hearing about the relationship part of it. That's a skill, I think, relating to people and listening that, you know, is needed in every job, but especially in nursing, to have that compassion to listen to them. Margot would like to know, kind of switching gears a little bit, how many years of experience do you need to become a traveling nurse?
That is a good question, and I don't know for sure. I would say depending on the specialty, because traveling nurses also have specialties. So there might be somebody who's a medical surgical nurse and they are looking only for that specialty. My guess would be probably at least 2 years now, because there's such a high demand. They would love it if a person had more experience than that, but I would think probably at least 2 years.
Okay. And kind of off of that, Courtney, we kind of touched on your question, but do nurses need to specialize in a specific area, and how do they do that?
You can specialize in a specific area. There are certifications that you can get. So like on a medical surgical floor, there are some nurses, if they decide to stay there forever, they can do some online education and then complete an exam and become certified in a specialty. We have some nurses that work here who are certified in chemotherapy. So they are the ones that can actually administer a chemotherapy drug to a patient who has cancer or needs it for some other reason. But every area really has a way that you can become certified in that specialty. Once you get the experience working in there, that's up to the person who chooses to do so to seek out those opportunities. And a lot of times the employers will help pay for that as well.
You went to school in different bursts or different times. How many years total did you go? And maybe how many years is it now that students are looking at for different types of nursing?
Okay, so if you were just going to school full time, you could get your RN degree in 4 years. The way I did it, when I went to the technical college, I went full time. I needed, because I had taken such a long time off in between going to UW Sheboygan and LTC, I did need to retake some of my general education just because it was too long. So it took me about 3 years to get my 2-year degree there, and there are a lot of credits that you need for your 2-year RN. And then when I did the BSN program, like I told you earlier, I chose to only take enough classes that my employer was going to pay, and they only pay a certain amount every year. So what I was doing was taking, I went through UW Milwaukee, and it was called a flexible option program. And every class I took, I had 12 weeks to complete that class. So I took only 3 classes a year because that's as much as I could get paid for. So it took me about 3.5 years to finish the extra requirements that I had. But again, you could go to a 4-year college and get your RN degree, your BSN, in 4 years.
Yeah, I think the key though is no student loans.
Right. And that's why it's so great if you get the CNA license and work at a facility that's going to help you pay for that. It's really a great opportunity.
Yeah, Sierra would like to know, are different hospitals harder to get hired at, such as Children's Hospital in Milwaukee?
Yeah, definitely. I think they look much more for people who already have some experience before they're hiring, but I know there are nursing opportunities at every hospital for entry-level nurses, depending on the area.
Okay. We have a question that's very similar from Jenny and Nadia. Over the years of your opportunities, what has been the most challenging but most rewarding? And kind of along that line, then the hardest part of becoming a nurse?
Okay, most challenging. School is tough. It is. Those clinicals uh, will make even me as a non-traditional student. I was older going into that program. You need a lot of reassurance that you're doing things the right way, and it builds your confidence, breaks you down a little bit, and then it builds your confidence. So just becoming sure of yourself and but not making decisions that you're being reckless about. Does that make sense? So it's stressful going to school, but it's so worth it. Just keep pushing through, find friends that can support you, form study groups, and just don't give up. The patient challenges, really, the personalities aren't so difficult with that. I think, as we talked earlier, it's easy to put yourself in their shoes and build a relationship with them. The surgeons, that can be challenging. Certain physicians, you have to be confident when you're talking to them, and you have to understand what they want you to tell them. If you have a question, you have to be organized and ready with the facts so that they can answer their question and move on. And sometimes they still don't want to answer your questions, but you have to advocate for your patients and ask again until you get the right answer. So I guess the physicians and school would be the most challenging.
Yeah, but we have a couple questions kind of going actually back to the shifts or the different times. So people were asking, how do the shifts look like for, say, labor and delivery, the cardiovascular floor, and then pediatric nurse?
Sure. Labor and delivery, it's really all three of those areas. If you have inpatient units in your hospital for those specialties, would be 24 hours. So again, the day shift would be the busy shift, where if you have a cardiovascular patient and they need to, this is when they're going to get the tests that they need done. If they need a stress test or any kind of cardiac cath procedure, anything like that. So for a nurse working the day shift, you have to be able to coordinate the care that you have to provide to that patient around all the other appointments that are happening throughout the day in the hospital. They might have a physical therapist coming to work with them or an occupational therapist. So that can be where the challenge is. You might have time to take care of that patient. Well, that patient's not even on the floor at the time. So balancing that all out. PM shift is a little calmer, but you have family coming in to visit them. You still might have therapy coming in. The patient's worn out and crabby because they're sore and tired from all the work they did during the day. And you're settling them in for the night and making sure that you're changing their dressings and everything else. Night shift is hopefully quieter, but sometimes you can get an admission during the night and that can shake things up, and you still have to check in on the patients who are sleeping or might need to get up and have a medication, even if they're sleeping. So each shift looks different, and it just, the multitasking part of it is different. OB, there's a lot of planned induction. So nowadays, when people have babies, they often plan out when they're due. We can come in the hospital, we can get a medication that can put us into labor, and we can plan out the delivery. But it doesn't always work that way. So you might have those planned births going on, and then a mom comes in unexpectedly and needs to be ready to have her baby as well. So with women's and infants, the day shift too is probably the busiest, but night shift can get a little exciting. They might need a C-section, which is when they'd have to go into surgery and have the baby a different way. But yeah, it's usually the day shift on any kind of specialty is the busiest. We don't have a pediatric unit at our facility, but we do take care of pediatric surgical patients. So there too, it's just the day shift that they're here. Occasionally we'll have a child admitted to our medical surgical floor, but sometimes depending on how sick they are, they would then get transferred to Children's Hospital in Milwaukee.
So thinking back, if med-surg is the place where a lot of nurses start or get the greatest variety of experience, what would a regular day or shift look like for that nurse?
The day shift would be, you start out your day, you get a report from the night shift nurse to find out how did your patient do all night long and what do they have coming up during the day. When are we anticipating sending them home? If we're not sending them home, where are they going and why? So you get your assignments. You usually work with a CNA who is going to help you take their blood pressure, check their vitals, help them get up and brush their teeth, and anything that they need to take care of themselves. The CNA is there to help you make sure that those tasks get taken care of. Before you go to see those patients, you prioritize. You figure out which patient is the one I really should see first. When you go in to see that patient, you start with a physical assessment. So every shift, every nurse listens to their lungs, listens to their heart. Depending on the reason that they're there, if they have some kind of a wound, you assess their wound. You do the whole full body assessment. And then you chart that in their medical record and you compare it to the shift before and see if there's been any changes that are for the good or changes that maybe don't look so good. And you have to report that off to the physician and find out why. And you move on down the line throughout your patients. Most patients are also on medications. So then you have a list of medications that they need to have at certain times. And you also have medications that you can give only if they need it, like a pain pill. So you have to prioritize that as well. In the meantime, they're getting their breakfast. And so you don't want to interrupt them. You want to give them time to eat, but there are also things that you might need to do at a certain time. So you will interrupt them. Depending, again, what they have to get done during the day, they might have to go get an x-ray or some kind of a lab work. So it's just coordinating all the appointments for the patient that day and making sure that you still can get all of your required assignments done.
So kind of going back, actually, we're going back to the schooling part of it. I'm getting a couple questions about who has a good nursing program, Madison, or what are some good colleges. And again, I know it kind of goes to, you can get it locally, a 2-year degree versus a 4-year degree. So maybe touch on some of the different schools.
Right. We are fortunate. We have a lot of good nursing colleges around here. Oshkosh always had a very strong nursing program. Madison is excellent as well. I went, like I said, even just the flexible option online for the last 2 years of my BSN through UW Milwaukee was good. If you'd go that route to get your associates of nursing at a technical college and then your BSN online, you really have to be a good, independent, able to self-study, self-learner, because I was pretty much, I felt at times, teaching myself. So you can ask questions, but it was a lot of writing papers and reading research and figuring things out on your own. But I would say if you are looking at an Associates of Nursing program, it's helped save money initially, and then you can decide if you would want to go on for your Bachelor's of Nursing. LTC is an excellent college. It has a great reputation. They really turn out top-notch nurses from that program. I think about 90% of the nurses that work at the surgery center started at LTC. And I think they rank number 2 right now as a technical college, something like that. So there are limitless opportunities.
Yeah, I think the big thing with the college is you have to remember if you're going to do a 2-year college versus a 4-year. 2-year, you come out and you take the same exam, correct, as the 4-year nurses.
A lot of people don't realize that even though it's an associate's degree of nursing and a bachelor's degree of nursing, in order to become an actual registered nurse, you have to pass this NCLEX exam, and it's the same exam. So since I had taken it after my associate's nursing program, I did not have to retake it after my bachelor's degree program. The difference, I would tell you in my own experience between the associate's program and the bachelor's program, is that the associates gave me a lot more hands-on opportunity and clinical situations with patient care. The bachelor's program was all about research and maybe management. We did talk about assessing patients, but there was no clinical involved in that. If you do a bachelor's degree 4-year program right off the bat, they mix it in throughout that 4 years. But from what I've seen in my own experience, I liked having that 2 years of heavy clinical experience to really get me to feel comfortable going in and now practicing it on real life patients.
Yeah, that's a very good point. So I think students, it just depends on, when you graduate high school, what you're looking to do. If you're looking to go for 4 more years of college, then maybe that 4-year path is right for you. If you're looking to get more into work right away, then I would say probably the 2-year path would be a better option to start with, because you get more into, like she said, the clinical part of it, and you're going to get working quicker, and then probably have the ability for some tuition reimbursement to gain that 4-year later on. We had a couple quick other questions asking about specific schools. Would you suggest getting the master's right away?
If you start going through school and learn more about different opportunities that would require a master's degree, then go for it right away. But everybody's journey is different. I thought I wanted to be an OB nurse, to deliver babies. And when I started having my clinical experiences in women's and infants, I didn't like it at all. So I was very surprised by that. So that's where 2-year clinical settings, you get so many different experiences. You really get to start understanding and appreciating that each area of nursing is different. And if you get bored, if you don't feel fulfilled anymore, you can move on to a different department within the same hospital and have a completely different job. It's kind of exciting that way. But yeah, a master's degree, if you get into school and start saying, I want to teach someday, then get your master's right away, because you will need that for teaching.
Yeah, we have a student that seems to be very interested in cardiovascular nursing. Is there anything special that they would have to do for that?
Not necessarily, except for looking for the opportunities to get more experience in that area. I did work briefly at in cardiology in a clinic setting. And one of the things I wanted to get better at was learning how to interpret cardiac rhythms. So the heart monitor strips. So I decided to enroll in a course to get better at identifying abnormalities. That's what I guess I would say, no matter where you are, ask for opportunities to learn. One of the best things I did when I was a nurse extern, the whole summer, they let me work full-time at the hospital. And I said, you know what? I want to start IVs, even though we hadn't been doing that in school yet. Because I was a nurse extern, I was allowed to work with an RN and learn to start IVs. So for 2 days, I went to surgery and I started IVs on 12, 15 different patients. When I was a new nurse on med-surg, we sent patients away during the day a lot to get colonoscopies and different procedures. And I said, I get to see them before and get them prepped for this procedure. I get to see them after, but I really in school didn't have an opportunity to see what happens during the test. Can I go to the floor that day and watch some of these procedures? So sure enough, they sent me down there and they were showing me, teaching me about the colon and what they were looking for when they were doing this procedure. By the end of the day, I was taking out the polyps. So ask for opportunities. I went into a surgery one day. I got to help admit a patient for a knee surgery. So I met her and I helped start her IV and I helped do her physical assessment. And then I went into the operating room and watched the entire surgery. And then when she woke up in recovery, I was the first face she saw, and she was so grateful that she knew me already. And then for the next several days, I took care of her on the floor until she was discharged home. And for me, that gave me such a good idea of not only the nurses, but every person who interacts with that patient, even the person who registers them when they come into the building, they all are important in making sure that that patient has a good experience. So ask for opportunities, and you never know what kind of interest you might find that it opens doors for you.
Right. Good point. Always be curious. I know we're getting long on time. I always like to ask Deanna, if you had anything to do over, would you change anything?
Oh, that's hard to say, because the only thing that would come to mind is maybe having gone to school sooner or finished my degree sooner. But at that time, I really didn't know I wanted to do nursing. And I worked in a lot of different areas of healthcare. And it gave me a better understanding of what I do and an appreciation for all the people that I work with. So I don't think I have regrets.
That's awesome. And my last question I always like to end with is, if you could go back to your high school self, what advice would you give yourself?
Well, have fun, but make sure you balance it out with your homework. Lean on your friends, and and make sure you put your studies. They're important. The best I did was when I started finding people who were in the same classes as me, and we worked together, and even working for my NCLEX, preparing for that big exam. I met friends and have lifelong friends now that understand what I go through every day and helped me get through it. So lean on your friends and make good choices.
So Deanna, today has been great. I know students, we've had a ton of questions. We might not have gotten to all of them specifically, but it's hard to touch on all areas of nursing. Deanna, thank you so much for your time. Thank you so much for being a nurse and taking such wonderful care of people. We appreciate it.
You're welcome, and good luck. And if you know people in the nursing field, ask them. Sometimes you can get opportunities to shadow and just go for a day and see what they do to find out if that's what you really are interested in. It's a little hard right now with COVID. There's a lot more limitations on that, but when we get through this, look for those opportunities.